What if I told you strokes are not just happening to old people anymore? That's right now, somewhere in your city, a perfectly fit 30-year-old is lying in an ICU, unable to move half of his body. We grew up thinking heart attack is for 40 plus, stroke is for our grandparents, but data says otherwise. Today, every sixth stroke patient is under 40. In US, the average age of first stroke has dropped by a full decade. In India and Pakistan, hospitals are seeing young tech workers, gym trainers, even students coming in with brain attacks. This is not a random coincidence. It's a pattern and it's growing fast ever. Stay with me till the end because by the time you finish this video, you will know what causes these early strokes, which warning signs your body is already showing, and 5 daily habits that literally decide whether your brain survives or not. David is 32-year-old with a software developer in Chicago. Typical IT life, late night, deadlines, delivery calls, 5 cups of coffee a day, and a constant sense that life is a race. One afternoon, he felt a slight tingling in his fingers. He shook it off. 10 minutes later, his speech slurred. He could hear his colleagues but could not respond. By the time the ambulance arrived, 20 minutes had passed. And in those 20 minutes, millions of neurons died. Doctors said it was ischemic stroke, a blood clot in his brain. No family history, no diabetes, no alcohol, just stress, fast food, and zero sleep. He survived, but the right side of the body still trembles when he types. That's the thing about strokes. They don't kill you instantly. They freeze you midlife. 2 decades ago, stroke was classified as an old age disease. Today, the Lancet Neurology Journal reports a 67% increase in strokes among adults aged 18 to 40. World Health Organization data shows 1 in 4 strokes now occur in people under 40. South Asia is the epicenter. Fast urban growth, junk diets, air pollution, and workplace stress have made this region a stroke factory. And the trend isn't just numbness on paper. The average stroke age has dropped from 58 to 47 in just 2 decades. Our bodies are aging 20 years faster than our birth certificates. Ask any 30-year-old, do you think you can get a stroke? 9 out of 10 will laugh because we equate health with appearance. You look fit, you must be fine. But strokes does not care about your gym selfies. It cares about your blood pressure, cholesterol, and sleep schedule. We spend thousands on smartwatches that count our steps, but ignore the blood pressure readings on screen. We say, grind never stops. Yes, until your brain does. This overconfidence is exactly why strokes hit the young harder. They arrive unannounced in people who believed they were immune. A stroke is a brain attack. When a clot blocks blood flow to part of the brain, oxygen supply stops. Without oxygen, brain cells start dying within seconds. Every minute of delay equals 2 million neurons lost. There are 2 types of stroke. Ischemic stroke, 85%, a blockage from a clot, and hemorrhagic stroke, 15%, a vessel bursts and bleeds inside the brain. For young people, the first type is most common because of lifestyle-based clotting factors, stress, dehydration, and poor diet. The worst part, the brain doesn't feel pain, so you realize it only after damage is done. We call it modern life, but it's basically a perfect recipe for stroke. Early mornings start with scrolling, nights end with scrolling. Meals are either late or liquid. Sleep is luxury and stress is a status symbol. According to Harvard Health Study 2023, young adults sleeping under 6 hours and working over 10 hours a day have a 30% higher risk of stroke. Our generation runs on caffeine, screens, and adrenaline. That's like driving a Ferrari with the handbrake on. Eventually, something snaps. A single can of energy drink can raise blood pressure by 15 to 20 points within an hour. 2 cans stiffen your arteries for 6 hours. That's the research of Loyola University 2021. Meanwhile, long screen hours cause neck stiffness, poor posture, and restricted blood flow to the brain, and add dehydration to that. Most young people barely drink a liter of water a day, and you have created the perfect environment of a clot. Now throw in smoking, junk food, and zero exercise. Congratulations, you are a walking time bomb. Dehydration makes blood thicker, clots form faster. Caffeine overdose, energy drinks, and pre-workouts spike blood pressure to dangerous levels. Smoking and vaping, nicotine narrows arteries and damage vessels. Birth control pills plus smoking, stroke risk increases 5-fold. Migraine with aura when mixed with stress or smoking can trigger mini strokes. Individually, these look harmless. Together, they are a toxic cocktail for the brain. According to the Lancet Public Health 2022, sitting more than 6 hours daily raises stroke risk by 34%. Office chairs are the new cigarettes. We think we are building careers. We are actually clogging our arteries. Human bodies were designed to move. Now they are confined to desks and car seats. That's why doctors now call it sitting disease. Sleep is for losers. Yeah. Tell that to your brain cells. Why they start dying from sleep debt. Because stroke doesn't start like a movie scene. There is no dramatic fall. It starts quietly. A tingle, a word you cannot pronounce, or a sudden blur in one's eye. John Hopkins found that 40% of young stroke patients had symptoms 24 hours before their attack. They ignored them, thinking it's just a stress or fatigue. The body was sending SOS messages. We were too busy replying to emails. Within hours of blockage, the part of the brain is permanently dead. Time is no longer money. Time is brain. Every minute counts. A stroke never appears out of nowhere. Your body always sends an SOS. Subtle, quiet, easy to miss. The problem, we don't speak the language of our own body anymore. The first sign might be weakness in one arm, or you try to smile and notice one side droops slightly. Sometimes you can't say a simple sentence. Words twist, voice cracks, you laugh it off. John Hopkins research shows that 40% of the young stroke patients noticed symptoms within 24 hours before their attack. Didn't act. They thought it was a fatigue, anxiety, maybe a cervical pain. Those 24 hours were the difference between walking again and never walking properly again, or being on the wheelchair for the rest of your life. Every hospital in the world follows one simple rule: FAST, F-A-S-T. F is face drooping. Ask the person to smile. One side sagging, that's F. A, arm weakness. Raise both arms. One falls, that's A. S, speech difficulty. Repeat a simple phrase. If speech is slurred or wrong, S is positive. And T, time to call emergency. That last letter is everything, because the clock starts the moment the first neuron dies. Every minute equals to 2 million cells lost in the brain. Mayo Clinic's Global Stroke Registry shows patients treated with 4.5 hours have 6 to 70% chance of full recovery. After 6 hours, the odds fall below 10%. So remember the mantra. Don't Google it. Go to hospital. The first question doctor must answer, is it a clot or a bleed? A quick CT scan reveals the truth. If it is an ischemic stroke formed by clot, the treatment is TPA, tissue plasminogen activator, a drug that dissolves the clot and reopens the artery. But TPA works only within 4.5 hours of symptoms onset. Arrive late equals to no miracle drug. For larger clots, doctor perform mechanical thrombectomy. They insert a tiny catheter into the artery, navigate to the brain, and pull out the clot like a thread from a pipe. Sound futuristic? It is, but it saves lives every day if you reach on time. We have built a culture that glorifies burnout. Work till you drop, that post a story about your grind. WHO 2024 estimates 2 million premature deaths each year from chronic work stress, the majority from heart and brain strokes. Sleep has become a luxury item. Harvard School of Public Health found that sleeping less than 6 hours a night raises stroke risk by 45%. Yet, meme cultures keeps repeating sleep is for losers. Reality check. Without sleep, your neurons can't clear toxins. This literally suffocate in their own waste. You don't burn calories at night, you burn brain cells. Let's talk science. Every time you stress, your body releases cortisol and adrenaline. In short bursts, these help you focus, but chronic release turns toxic. Cortisol hardens arteries, thickens blood, and raises blood pressure. Adrenaline speeds the heart and shrinks vessels. Combine them, and you can get a perfect storm from stroke. That's why calm people are not just spiritually peaceful, they are physiologically protected. Meditation isn't hippie stuff, it is literally vascular medicine. Now, 5 habits that can save your brain. Check your blood pressure weekly. A home blood pressure machine costs less than a pizza. It could save your life. Drink 3 liters of water daily. Dehydration thickens bloods and forms clots. Cut salt and sugar. WHO recommends less than 5 grams of salt a day. Processed snacks are sodium bombs. Sleep 7 hours minimum. Your brain detoxifies only during sleep. No sleep, no repair. Move every hour. Sitting is the new smoking. Do you know that? Stand up and walk for 5 minutes every hour. Which of these 5 will you start today? Angela was 28, a teacher in school. While teaching, she suddenly froze mid-sentence. Her student laughed, thinking she was acting, but she was having a stroke. Her colleagues recognized the signs and called an ambulance immediately. Within 30 minutes, she received TPA. 3 months later, she was back to the school with a slight limp and a stronger purpose. It tells every student, never ignore your body. I used to teach others, but stroke taught me the most important one. Health comes first. Now that's the story of hope. That line always hits hard because it's true. Stroke isn't just a medical problem, it's a social failure. Schools don't teach basic body literacy. Offices don't have mandatory mandatory blood pressure checks. Governments spend billions on tech, but pennies on prevention. Imagine if every college ran a free blood pressure week. Thousands of young lives could be saved each year. Health awareness should be as viral as meme. We post about mental health but ignore physical symptoms. We track screen time but no sleep time. We buy blue light glasses but forget about eye rest. Our brain is wired to seek dopamine hits, likes, views, notifications. But dopamine addiction is a form of chronic stress also. Each ping spikes cortisol. Each scroll keeps you awake. It's a perfect recipe for a slow neurological burnout. Digital detox isn't fashion, it's a first aid. The brain is your priceless hardware. It's a supercomputer with 16 billion neurons and 100 trillion connections. It runs 24/7, processing your memories, emotions, and decisions, and you are fueling it with junk food and stress. If a phone battery overheats, you put it on charge. When your brain overheats, you ignore it until it crashes. Remember, there is no restart button for neurons. The silent recovery. Surviving a stroke is just the beginning. Recovery is a battle of patience. Physiotherapy teaches the body to move again. Speech therapy teaches word to return. Family support teaches hope to survive. Neurologists say the brain is plastic. It can rewire itself, but only if you start rehab early. That's why awareness isn't optional. It's the difference between life and living. If the video opened your eyes, don't just like it, share it. Because the person who needs to see it might be scrolling next to you right now. Comment below. I will protect my brain. Let's make that movement. Until then, remember the FAST rule. Time is brain. Act fast. My name is Dr. Raza. I am a practicing family physician in USA for the past 18 years. I am an American board-certified physician and diplomate of American Board of Family Medicine.